This segment of Delmarva Life is brought to you by Delmarva Chiropractic.
Okay, so we've talked about what keeps us from getting to sleep and what keeps us from staying asleep. Now, let's talk about sleeping positions.
Did you know that there is a right way and a wrong way to fall asleep? Think about it for a second. Your body can stay in one position for several hours depending on how deep you sleep. And that can have painful consequences that leave some people feeling it as soon as they wake up.
Sleep is necessary. It gives your body the rest it needs to function properly. But according to Dr. Daniel Lane of Delmarva Chiropractic, there's a right way and a wrong way to sleep, especially as you get older.
It depends now on your body's morphology and what type of person are you. Are you lean? Are you heavy? How wide are your shoulders?
Dr. Lane's talking about sleeping positions and says sleeping on your stomach is probably the worst of them all.
You're basically reversing the curves, the natural curves in the spine when you're doing that. You're taking the gravitational system and reversing it. So we can do it when we're younger typically just because of the fact that we haven't suffered many injuries. Most people attest to the fact that as they grow older and they have these injuries going on and arthritic degeneration, that sleeping on their stomach is something that they can do less and less of.
So that leaves the back and the side positions.
We like to prescribe is for people to lay on their backs and their sides, and preferably to change. Now, you can't time in your sleep how much time you're going to spend on each one, but people will either say that they're back sleepers or side sleepers, or start on their back and end up in their sides.
And even then, Dr. Lane says there's a right and a wrong way to sleep in those positions.
In an ideal world, if you're sleeping on your side, which is the predominant position that most people favor, you want to have your legs parallel with each other without any curvature, because that's going to put stress onto the sacroiliac joints and the pelvis and ultimately the lumbar spine.
Dr. Lane suggests using a pillow or foam block to place between your knees to keep your legs straight. You also need to be sure your head is in the right position when you sleep on your side.
If your spine's going straight up, and imagine I'm laying down on a bed now, you don't want your head like this because the pillow's too small, or you don't want it like that because the pillows are enormous. You have a natural contour that occurs in your neck where this, if this is the bed, this distance is greater than the distance from your head to the bed. So you want more padding at your neck and less at your head.
Dr. Lane says you can buy certain pillows with the contour, or you can take your own pillow and roll up the end so that you get the contour to keep your spine and head aligned. But Dr. Lane says the sleeping position that sends the most patients to his clinic is the one where the arm and elbow are tucked up under the pillow.
That leads to all sorts of shoulder problems and neck problems, rotator cuff syndromes. It's difficult not to do that, especially when it's habitual, but it's something that you want to try and train yourself out of.
Dr. Lane says when people come in with sudden pain and they haven't done anything that would lead to injury, their sleeping position is usually the number one culprit.
I mean, the number one cause that I see in my clinic of injury, if you can call it cause of injury, is sleeping.
Now, when it comes to your mattress, Dr. Lane says he doesn't recommend one over the other. He says just make sure you take your time and really get to know how a mattress feels before you purchase it.